Hello, I am Michael Lawler. I'm a social worker at the University of Iowa Hospitals and Clinics, and I'm also a member of the Congolese Health Partnership. And I'm just here with an update on COVID-19. We have been living with COVID-19, the disease caused by the coronavirus, for 9 months. We are all getting tired of this virus. Unfortunately, there are many more cases of COVID-19 right now than in April when we first learned about the coronavirus. Cases are going up in Johnson County and all over Iowa, the United States, and many parts of the world. Here is a map that shows how COVID-19 has spread in the United States. The darker red areas show where there are more cases of COVID-19. You may have heard that there are less cases in some countries in the world or some towns in the United States. A person's risk of COVID-19 is related to where they live now. All people living in eastern Iowa share a high risk of infection because there are many cases in our community. Anyone can catch COVID-19 if they are in close contact with a contagious person. It is very important to prevent COVID-19 because there is no cure. Strong prescription medications cannot cure COVID-19. Home remedies cannot cure COVID-19. It is important to prevent COVID-19 because hospitals in our part of Iowa are almost full. Doctors, nurses, and other people who work at the hospitals are getting tired. Schools are shutting down and businesses may have to close too. We all need to do our part to protect ourselves, our families, and our community. The answer is simple. Wear your mask whenever you leave home. Wash your hands frequently. Stay 6 feet apart when you are with other people. Get tested if you notice symptoms and stay home if you are sick. You can get a test at the University of Iowa or at certain pharmacies in the area like Hy-Vee, Towncrest, and North Liberty Pharmacy. Please call 319-384-9010 to schedule testing at the University of Iowa hospitals and clinics, or call the pharmacies previously mentioned for instructions on how to schedule a test. Do not get together with others if you test positive for COVID-19 because you can spread the virus. If we all do these simple things, we can help bring the numbers down again. Vaccines to help fight COVID-19 are ready and have started to arrive in Iowa. These vaccines have gone through very careful development and testing to ensure they are safe and effective. Now that the vaccines have started to arrive in Iowa, healthcare providers have been the first to receive the vaccines because they are at increased risk of becoming sick from COVID-19. As more vaccines are manufactured and delivered, other high-risk populations, like the elderly, will be able to receive the vaccine. Vaccines are expected to be available for the general public sometime in 2021. Even with the vaccine, we may still have to wear masks and stay 6 feet apart, but if we all work together, we can get through this. Thank you.